Dr. Pham from Miracle Dental in Las Vegas. I have had a lot of questions regarding laser dentistry, so today I will be answering some of those questions just so we can all understand better about this topic. So what is laser dentistry? In dentistry, laser has been around for many years and it's been applied in so many different industries, in medical field, of course in constructions, and almost any other field that you name it. But in dentistry, we use the concentrated light energy to help reshape the gum, to do biopsy, to do gum contouring, to remove the inflamed oral tissues. We even use it for whitening too. So very a lot of good usage for the laser. But we categorize them as laser to use on soft tissue, hard tissues, and for other use. So when laser is used on soft tissues, it means that we go into area that pertain to just the soft area in your mouth. So, of course, the gum come into mind. So with that, we meant that we use a laser to treat the gum disease, being the most popular, most common type of treatment. When it comes to hard tissues, it means we can use laser to do some of the cavities. And in other procedures, we can use laser to do whitening. We can use laser to do frenectomy. We can treat canker sore too. So very useful, and we're very grateful that laser have been being a great part of dentistry. The next question is, how does the laser work in the gum treatment? Okay, so when it comes to gum disease, you need to understand what does gum disease mean. It means that there were a lot of tartar buildup, a lot of bacteria, a lot of issues with your gum that cause the gum in the bone to recede. So when the dentist measure the pocket, usually these patients have very deep pocket, okay? So the first thing the dentist would have to do is to go in and use the Cavitron or the machine that shoots out a lot of water to remove the big chunk of calculus and tartar. And then we go in with the hand instrument to smooth the root surface. In the past, that's all we had to use, and the understanding stops there. But there are a lot more bacteria that goes on underneath in a deeper level. So thanks to the laser, we can use a laser beam. We can apply the laser beam to go deeper into the pocket. We go back and forth many times, first to reduce the bacterial level, and later we can use that laser beam to remove the inflamed tissue. So by the time everything is done, less bacteria, the tartar calculus has been removed, the root has been smooth, and well, the best thing is that with the laser, it can help with the bleeding too. Usually these patients have a lot of bleeding to start out with. So with the laser, it seals the blood vessels, so it can help control the bleeding very well. And because of that, the healing time is incredible. Patient go home feel a lot more discomfort than if we didn't have the laser. And of course, it cannot replace your good home care. So with good home care, with all the treatment that's been delivered in the office, the pocket has been reduced. We notice the change is pretty prominent. So it's a wonderful tool that laser has to offer. So what's the difference between the laser gum treatment versus the traditional deep cleaning? Well, we need to differentiate the two. The traditional treatment for the gum disease is the deep cleaning, or the terminal medical term is scaling and root planing. That is the main protocol, the main treatment to treat the gum disease. So the dentists have to go in, clean up physically clean the tartar, go down to the deep pocket to smooth the root. So that's the basic. You cannot replace that. So when we use a laser, it's only meant to assist, as a supplement, as an adjunctive treatment on top of the deep cleaning that you need to have done. So it's not about laser is better or the traditional is better. Laser is meant to help to improve the result. and to help you feel better and heal faster. So what's the pros and the cons of the laser? Okay, so again, the pros of the laser is that you heal faster. It removes more bacterial load, as opposed if you don't use laser, there's still a little bit of bacteria still left into the socket, and it doesn't require any cutting, any stitches, and the soft tissue is removed along, the inflamed tissue has been removed, so the result, the goal for any gum disease is to reduce a pocket, and the result will come out a lot better with the assistance of the laser on top of the regular deep cleaning. The cons of the laser is that needless to say, it will cost more, and it does not replace the traditional physically scaling and planing of the root that the dentists have to provide. Well, it takes a little extra time, but the time shouldn't be a problem. It takes us about a few extra minutes. The insurance doesn't cover the laser at all, so just keep that in mind. Other cons of the laser is that don't just rely heavily on the laser. It cannot replace your homework on brushing and flossing well, and come back to see the dentist every 3 months. And the setting has to be right. If it's too strong, sometimes it might burn your gum and some of the tissues in your mouth. And another thing is there might be other deeper, bigger problems with the gum disease. There's still other defects. The laser is not a one thing that treats all. Again, it's just an adjunctive treatment that we found to be very helpful on top of the deep cleaning. But if you have any further bigger, deeper problem, the dentist will advise you to look into more treatment than just the laser. Next question, how does the laser help with the filling? So the laser, we can use a laser beam to go into the hard enamel of the tooth, and it can cut some of the tooth structure. Mind you, the enamel is very hard, so the red beam of the laser can only cut so much. So that's why with the laser filling, you cannot really use that to treat the deeper, bigger cavities. It cannot replace a traditional drill and the burr that dentists use to go into the deeper, bigger cavities. But in case you have very small filling, it's actually a very good tool. Sometimes with that laser machine, you might not even need to be numb. And when it comes to not getting a shot, a lot of patients are probably going to raise their hand and sign up for the laser when it comes to not needing the shot. Next question, how does the laser assist or help with the teeth whitening? Okay, so you understand what's the mechanism of whitening, teeth whitening. So we use, the main ingredient is hydrogen peroxide or carbamide peroxide. After the dentist or the staff isolate the gum, we put a very strong gel of hydrogen peroxide or carbamide peroxide onto your teeth. It will take some time to absorb into your teeth. So while waiting, we can put the laser or a light source to activate the chemical, make it work a little faster. And keep in mind the result. Sometimes if you give it enough time, it will get you to the maximum result that you are looking for. But with the light, it just speeds up the result just to make it a little faster. So it definitely helps with the patients that don't have much time or anxious to see the result faster. Next questions, how about laser used in gum contouring? Lots of time we're talking about the front teeth in most cases here. So when people smile, some people show a lot of the gum. It's called gummy smile. So we can use the laser to come in and shape the gum so that the gum level is more even across the front teeth, or you will show more teeth and less gum. Okay, so when you use the laser to cut the gum, reshape the gum, is less sensitive, is less bleeding, less trauma, so the healing time is better. The only thing is not everybody can be a candidate to have that laser procedure done, because there are certain cases require more than just the cutting of the gum part. There might be some bone reshaping too. There might be some people that have certain gum disease to start out with. So they're more than just reshaping the gum, but at least knowing that the laser can help offer some of this advantage to help the reshaping the gum, that's actually a huge plus. So that's how the reshaping of the gum by laser work. Another case that you can use the laser to reshape the gum, especially in the younger adults, when the molar just barely come out of the gum. Some of the teeth are erupted, but let's say half or more than half of the tooth is still under the gum. So it forms a pocket. Food tend to go into the pocket and cannot come out. So lots of time they have inflamed gum there, or it trapped bacteria causing cavities. So the dentist cannot really drill that cavity out to put the fillings in for you unless we have to shape, clean up the gum, take the gum on top of the tooth out so the tooth can be totally exposed for us to do the filling. So that's when the laser can definitely be in such good use for. The patient, we cut the gum around the tooth. The bleeding is controlled. Patient goes home, don't feel too much discomfort. So that's a win-win. How do I know if I'm a candidate to get the laser done? The dentist would definitely evaluate your situation, evaluate your case, and will advise you accordingly. But the laser in general is best applied for the deep cleaning. Usually it's laser applied to deep clean maybe 80% of the time. The reshaping of the gum, the dentist can definitely evaluate and see in your case if just the laser application is good enough, or you need to have the bone reduction too. That can definitely be assessed and discussed. Teeth whitening is always a slam dunk. You can definitely get that done anytime. The pericoronitis, the area, the part where your tooth just barely erupt, and the dentist can use a laser for that, is definitely you can definitely be a good candidate for that. But in general, come in and talk with the dentist. And now that you know a little bit more about laser, have a discussion with the dentist to see if you're a good candidate. How much does the laser cost? One important thing that you need to remember is that the insurance doesn't cover laser at all. They're not there to take care of you. So when any new technology, any new development comes out, they are the last to adopt and to be willing to pay. So that's that. In general, it can cost anywhere between $200 to up to $800-900 depending on procedure. In general, it's depend on the severity of the case, the complications of the case, and the expertise of the dentist, how much involved do they have to use a laser for. But anywhere between $200 to $800-900 is the range that you can keep in mind for. I hope I explained and answered some of the questions that you have in mind, giving you a better understanding what the laser dentistry is about. In case you have any further questions, feel free to give us a call at 702-456-0056. We will be more than happy to take care of you and answer any further questions you have. Okay? Have a great day.